answer. Everybody ready? Come on, right? Okay. Joe Franken?
Okay. Good morning. The State Department of Health announced this morning or over the weekend no new cases. That means the case count for Minnehaha County remains at 3 for coronavirus in our community. I would like to encourage everyone this morning that while we do continue to have 3 cases in Minnehaha County, and we've not seen that increase over the last few days, I would not want anyone to get this good news over the last few days. We need and must stay vigilant in our commitment to social distancing and practicing good respiratory hygiene and hand washing. Based on updated CDC guidance that came out just yesterday, we intend to take recommendations to the Board of Health, which may become regulations that will be presented to the City Council to limit single gatherings of 50 people or less in our city-owned and operated facilities. In the interest of public health of our communities, private organizations in our community are encouraged to abide by this same 50-person limitation. So social distancing means that people, especially those most vulnerable to this disease, need to avoid mass gatherings. Those include older adults, and those include people who have serious chronic medical conditions like heart disease, diabetes, lung disease, or other conditions that make them perhaps immunosuppressed or more susceptible to disease and the impacts of disease. So again, also in terms of social distancing, I want to speak to parents. I want you to please keep your students from gathering together this week. Schools are closed, and it's in an effort to keep students separated. Please, students should be remaining at home and not gathering together. This is a time also for us to be calm, and it's a time for everyone to be a good neighbor. If you know of an older person or someone that is concerned about being out in the public, please offer to help them. Offer to go to the grocery store for them, see if they need assistance with errands, and make sure that they are doing okay while they are quarantining themselves, isolating themselves, protecting themselves from being exposed to coronavirus. Perhaps offer to babysit and help people that need to go to work. I'm just suggesting these things because it's important for us to think about ourselves as a community and how we're going to get through this together, because we are one Sioux Falls, and it's our responsibility to be doing what we can to impact our community in the most positive way possible. So please know the signs and symptoms of COVID-19. Those include fever, cough, shortness of breath. And if you are ill, call ahead to your medical provider. Please don't be going directly to any healthcare facility on your own. Please call ahead. This situation is extremely fluid right now, meaning information about this response and guidance from the CDC continues to change. Please use trusted sources of information when looking for disease information. COVID.sd.gov is one source. They have a 1-800 number as well for this that the state has provided. That's 800-997-2880. And then also another resource is the cdc.gov. For any other assistance needs, please contact 211 and they will help guide you towards anything that you may need to help you as you're dealing with this response in the community. So with that, I would like Dr. Brian Maher, Superintendent of the Sioux Falls School System, to come forward and say a few words.
Good morning, everyone. Thank you, Jill. I would say, first of all, that the One Sioux Falls, fairly recently adopted motto in our community, has never been more evident to me than it has been during this past week. We feel thankful as the Sioux Falls School District to be part of the ecosystem that is the city of Sioux Falls. I would tell you, as citizens of this community, we've had a tremendous amount of interaction with Jill Franken, with Sandy Frentz, with Reed and Smith, and with numerous other peoples. I've had direct interaction with our mayor, and the support that we feel as a school district from our city is phenomenal, number one, and incredibly comforting, number two. So that's the first thing I want to say. The second thing I want to say is our chief role is the development of students. Almost always that development is academic in nature. But right now our role has changed from an academic responsibility to a social responsibility. And given the information we've received from our health partners in the community, following the recommendation of our governor, part of that social responsibility is closing down our schools this week. And who knows, that may be just the beginning of that interruption. As we participate in our social responsibility to limit the spread of the coronavirus, I would encourage our parents to do the same in the household. And that is, I would say, put together a family plan on what this is going to look like this week and what this is going to look like in the event of an extended absence from school. And you might say, well, what does that look like? And I think it can look like a lot of things. I think it can look like card games. I'm talking the old playing deck of cards, board games, things like that will engage the brain of your children. Let them have fun, but make sure that they're thinking while they're having fun. Technology, there are endless resources in technology, but I would encourage you as parents to make sure that technology is engaging the brain and not just passive and staring at a screen. So I'd really like parents to really think about that. In our role to help with that as a school district, we will be putting together an educational depository on our website. If you go to our website, you will see very prominently displayed the coronavirus button. If you click on that, that information will be there. It's not there yet, but it will be there by the end of the day today. And we will vet those things that we put up there, and those will be free resources available to you. The other thing that I would say is we've done what we could in terms of being age appropriate and sending home technology with our middle schoolers and with our high schoolers. If we get to an extended absence, I want you to know that we will figure out how to engage your child academically. Some of that engagement will be from a technological standpoint, but we are also putting together a distribution plan right now for packets of information, because we know it's not merely enough to have a device, it's also critical to have connectivity. And we're cognizant that not all of our families have that connectivity. So we'll make sure that we have options, both technologically and the old paper and pencil method as well. With that, I'll close by saying, again, it's truly comforting to work in the environment of the Sioux Falls City during this uncharted time for us. And I'll turn it back over to Jill Franken.
Thank you, Dr. Maher. With that, I would entertain any questions that you may have for either of us this morning.
Do you get any information from the state about how many local people have been tested?
The information that we get from the state is what is posted on the state's website. And so they have that chart that they identify of the number of cases that are tests that are positive, the number of tests that are negative, and the number of tests that are pending. And that's the information that we're receiving as well.
Do you have any concerns about the number of tests that have been completed?
As far as the number of tests that are completed, I do know that the health systems and all of those that have testing capabilities in our community are working hard within the number of tests that they have to identify those individuals that are the highest priority to be tested. And then certainly as additional testing capabilities are here, the number of tests that we can utilize, then I'm sure those will be expanded.
Any idea locally when those numbers might increase as far as the number of tests?
I can't answer that this morning, but we can get something back for you as soon as we're aware. Thank you.
I'm sorry, so the 3 that you mentioned, are those the 3 that are being added to the 9, or is that the number period? Is it gone from 9 to 3?
There are 9 cases in South Dakota.
Okay,
Of those 9 cases in South Dakota, 3 reside in Minnehaha County.
thank you.
And those 3 are the 3 cases that were announced earlier last week.
When it comes to groups or gatherings of 50 or less, as the city council looks at that going forward, what could that mean locally for businesses or restaurants or bars?
Right now, the ordinance and regulations that will be recommended to the Sioux Falls Board of Health that will go to then the city council, those would be regarding our city-owned and operated facilities specifically. As far as beyond that, like I said, I encourage all in our community to be considering it's all about social distancing. There's things that we have the ability to influence, and those right now are our city-owned buildings. But there is a larger aspect to this that is our entire community. So any business, any entity should consider what do they need to be doing to protect not only their customers, but their employees, in making sure that we reduce the spread of coronavirus in this community. And so all actions that can be voluntarily taken today to make sure that we're following that guidance, especially right now, would be important for everyone to take under consideration. I don't think it would be, we would appreciate if it's all voluntary. That would be the absolute ideal, is if there's voluntary consideration of that type of guidance.
Can you give an approximation of about how long this suggestion will go out?
Which one specifically?
Like the 50 or less?
Well, it is a good question. It wasn't only days ago that we had to go to the city council, which was Thursday, around the recommendation around restricting 250 or gatherings of 250 or more. That was Thursday. On Sunday then, we have the recommendation of 50 or more, that we restrict gatherings of 50 or more. So it is, as noted earlier, extremely fluid. And so I really, at this point, couldn't even tell you how long that will remain in effect before additional guidance is identified. But I would imagine we should be very vigilant to be watching what the CDC is putting out, and then being able to respond to it and be looking at how to we be as proactive as possible as a community.
For those city-owned facilities, how will the city ensure that city utilities will continue as normal?
Sure. Well, we have actually a whole section of our Emergency Operations Center that is dedicated to making sure continuity of operations for all of our public services are maintained, and especially those essential services. So they are working on that now to make sure that we've got that well in hand.
So just to clarify, the 50 or less on public things, that's gonna be an indefinite recommendation? You're not putting a time frame for the next week or 2 weeks?
The guidance that's out there from the CDC is identifying that should be something we consider for the next 8 weeks. And we are working to write regulation that would be in line with that guidance for the regulation that the Board of Health will be considering, that will be going to the City Council, that it will be consistent with those recommendations. We haven't written that exactly yet, but that is, we would want to be in line with that CDC guidance.
With the 8 weeks?
Correct.
this past weekend, St. Patrick's Day, people were out and about. I mean, you talked about social distancing. I mean, is that something we should avoid, is going downtown like that in a big crowds? I mean, I know St. Patrick's Day is a holiday, but I mean, families will be gathering for Easter coming up in the coming weeks and stuff like that too, so.
Everyone in every venue should be looking at how to avoid being part of crowds of people. That is a number one job of our community right now. We have a chance to impact this, and we have a chance with the actions we take now can have long-lasting implications for weeks for us. So what we do now, voluntarily and as a community, say we are going to take ownership and responsibility as individuals to abide by being socially distancing. It will have a positive impact for our community, but we have to be vigilant about it right now. The time is now for us to act on that.
With acting, have you been in conversation with hospitals as far as what they're prepping for this, if they're expecting to be able to accommodate a worst case scenario when there's a lot of infections?
Absolutely. Both of the hospitals have plans that they've had in place, and they have been testing those plans. They have been revising those. We've all been working on this as healthcare entities for at least the last decade, and then testing those out when needed. We had to use one with Ebola, and so they have really well-crafted plans that they are utilizing right now.
Now, I know you said it was a recommendation on the 50 or less for private, but if it came to that, is that something local governments have the control of, or would that have to come from the state?
I'm going to hand this one off to Mayor Paul Tenhaken to regard that question.
Hey, good morning. Yeah, I'll bring the attorney up here with me too. So we as municipalities technically don't have the jurisdiction to mandate closures of businesses, mandate bar, restaurant closings, things like that. So that's not a municipal level decision. That would be a decision that we would look to the state to help us with, and guidance that we look to the state to help us with. The role we're taking with that right now is saying, this is what we're doing at our city-owned properties and city-owned facilities. So we're asking and strongly encouraging the private sector to follow suit. We're not mandating anything, and because we can't at this point. But much like we did last week when we signed the 250 and over kind of restriction in city-owned facilities, a lot of the private sector, a lot of the faith community all kind of followed suit. So we're asking for a similar approach with kind of this new level of precaution that we're taking.
We have people that are asking about the malls. Can you give us a little bit of insight into that?
Yeah, the mall is still open, but different stores within the mall are adjusting their policies and hours accordingly. So Simon Properties, who runs the mall as a whole, they have not decided to close down the mall or shut down the mall yet. And I'm not saying they will, but as of right now, that's a store-by-store basis on the decisions that are being made on those retailers, but the mall's still open.
Question for Dr. Maher, actually.
Don't be afraid to ask the mayor any questions you have for me.
In the event of a longer-term absence from school, what, I guess, are the contingency plans for maybe an extended school year, or how it could affect graduation? We've had parents, especially with seniors, ask how this could be handled going forward.
Yeah, today I don't know the answer to that question. I expect we'll get guidance from the Department of Education and from the governor's office on what we'll have to make up and what might be more permissive in terms of makeup. So that one's way too early to call. And I believe that you've been getting information from parents. I got the most awesome email from a Lincoln High School student last week asking me to make sure that she can walk across the stage in May. And certainly that would be my goal. It's way too early to make a call on that.
when it comes to the CDC recommendation of 50 or less, if school comes back into session as normal Monday, how is the district kind of going to handle that guidance?
Yeah, we're putting in some social distancing requirements in our buildings. Things as simple as the lunch line. It's going to extend a whole lot further than it used to. But that's important, those sorts of things that we would do. And I'm not convinced we'll be in school on Monday. I mean, I think that's so much changed so quickly last week that we'll see if that happens. Again, I think right now our responsibility is a social responsibility, and if it's wise to be back in school on Monday, we'll do that. We'll do that for lack of interruption, the academic learning, the continuity that takes place there. But also there are a whole lot of parents who could get their lives somewhat back to normal if we're in that situation. So I hope we're there, but there's certainly no guarantee that we'll be there even Monday.
Given that, hourly, paraeducators, administrative staff, are
Yeah.
they being paid during this time off?
They wouldn't be paid right now, but we're gonna figure out how we do that. We don't wanna lose employees because of this, and so we'll figure out, with our Board of Education, we'll figure out how to make sure that everybody gets compensated, either an opportunity to make up that time, or if it's an extended period of time, then maybe there's just some sort of grace given for that time lost. I don't know what that is, what that looks like today, but I do know this. If we let those folks go and we don't pay them, they're gonna be snatched up really quickly by other employers, and we would have a whole different problem whenever this coronavirus issue passes. So we'll make sure that we take care of our employees.
Are you taking actions to ensure students get lunches or other meals?
Yeah, I'm glad you asked that question, because I failed to bring that up early. Again, part of our social responsibility, immediately when we knew schools were going to be closed, we knew we were going to feed kids. And so that was a no questions asked for us. At the time we made the decision, we didn't even know if those lunches would be reimbursable. Since then, we found out that they will be. So it won't be a financial hardship for us, but we would have done that anyway. We've also had unbelievable outpouring of help from many in the community, for-profit and not-for-profit, who have said, how else can we help to make sure that the food insecurity issue doesn't become more of a problem? And so if you'll go by several of, you can see on our website, we have several buildings open from 11:30 to 12:30 today for lunches. And I would tell you that if we extend into next week, we'll figure out how to distribute lunch and breakfast to our students.
Given that transportation could be an issue for some of those with free and reduced lunches, they can't get to the school,
Yep.
How are they gonna get those free and reduced lunches?
Number one, we set up in our free and reduced lunch sites. So in terms of being in our community, we're very strategic in where we set up those sites. So in almost every case, it's walkable for the majority of our kids who are on free and reduced price lunches. Not for all of them, but for the majority of them.
And for those that's not walkable, is there a plan for that?
I don't have a plan for that.
And those lunches are available, are they available in the school and by take and go?
Yeah, those are grab and go. Those are box lunches. And those are available for any student. You don't have to qualify for free and reduced price lunch. Those are available for any student who would come to that site.
I think I looked at Monday through Fridays, or Monday through Wednesday initially. Is this Monday through Friday now, or is it?
It is Monday through Wednesday. There will be other options Thursday and Friday. That Thursday and Friday were not school days for us.
Okay. One question I had related to continuity. You have taken care of addressing some academic but social needs as well. You think of the special needs students, those can be the most challenging.
Yeah.
What's the plan for connecting with those students
Yeah.
for continuity of education and other skills?
That's a great question, and I would tell you that it's even more complex. You know, when we're talking about our special needs students, those students have an IEP, an individualized education plan, and there is great nuance from student to student who is on an IEP. So there's not a one plan fits all for our IEP students. Some of our special needs students will be able to be responsible for their own learning, just like their non-IEP colleagues. Some of them need a great deal of care. So we may be providing some homebound instruction that we don't ordinarily offer that student. We would offer that student in our building, and we'll just have to see exactly what their IEP states to make sure that we give them the best service we can give them.
If there was a request you could make of the state in terms of, I know it's uncertain, but what would be the priority you would look at saying, okay, we need assistance with this? Is it waiver of testing in the future?
Yeah, it depends. So it's so hard to answer that question right now. It depends on the duration. If we're out of school for a month, if we're out of school for longer than a month, I think waiver of testing will be crucial, or at least delays in testing. I think waiver of attendance requirements. I think some of those things have to be addressed, and they will be. I know our Department of Education is aware of those. I know the governor is aware of those, and so I really believe that we'll come to a logical conclusion. We just need more information to figure out what problem we're dealing with. Thank you.
Thank you, Dr. Maher, and thank you all for being here this morning. I think I'll turn it over to Sam Clemens. Thanks, Sam.